Welcome everyone to this London Policy and Strategy Network session. As I said, this is the second one this week. The first one we had was how to embed involving residents in policymaking. And this one here today is all about community and peer research, which is obviously a method that you can use to involve residents in policymaking, but also a method to involve residents in a whole wide variety of other things as well. And that's what Emily, Ruby, and Jitendra are going to talk to us today, and there'll be an opportunity for kind of breakouts as well, so that you can connect with each other and share what you're doing in this space. So I'm going to hand over to Emily, who's going to kind of take us through what community and peer research is. So over to you, Emily.
Hi everybody, really nice to see so many people here today. Really looking forward to getting to know some of you guys and hearing some of your thoughts. What we're going to start with is a presentation, and then we'll have some opportunities to hear from some of our lovely community researchers. So you'll see Ruby and Jiten, maybe give a little wave, guys. They're two of our community researchers, so they're going to talk to you guys a little bit as well. But we'll start with a kind of more formal presentation, and then towards the end we'll have some breakout rooms and have a chat about, you know, anything that is helpful for you guys to speak about. So I would suggest maybe we can think about how, or if you'd like to use community research in your teams, how to do that. But if there's anything else particularly that is on your mind, please let me know. So what would be really helpful, as Noel mentioned, I have no idea who's in the room and who's got different levels of experience and what your knowledge is. So please do feel free to post in the chat who you are. But it would also be really great to hear if people could let us know if they have experience of community peer-led research. So if you do, just say, yes, got tons of experience doing this, just want to learn more. Or if you are completely new to it, please feel free to say, I have no idea what the topic even is about today, and I just thought I'd come along. That's also totally cool. So whatever you'd like. And in the meantime, I will start my slides. So just to let you know, I'm not going to be able to see the chat while I'm doing the presentation. And I'll try and keep a bit of an idea on it later. But if there's any really key questions that you want to raise, when we come to discussion, please just raise your hand and speak and let us know. Noel's going to keep a little bit of an eye as well in case we miss anything in the chat. And also a quick warning, my 5-year-old is home with the chicken pox. So at any point we might hear about dinosaurs or trucks as he runs in and get shooed out the door. So yeah, apologies in advance if that gets included. Let me get the window up. Here we go. So hopefully you can see that. While we're doing the slides, please make sure you turn off your mic just so that we don't get any background noise, as that's always a little bit annoying for everybody and can make it a bit harder for people to hear. So community and peer-led research, lessons learned and how we do it. So my name is Emily Ahmed. I'll tell you a little bit more about myself in a moment. And as you can see, some of the pictures here are of our lovely community peer research team in Newham, who you are going to hear from and all about. There we go. There we go. So just really quickly, so you know who I am, and I guess a little bit about my background and where my areas of expertise are and are not. So my name is Emily Ahmed. So I've worked in community engagement for forever, really, for like over 20 years, NHS, local authority, a lot of work in the voluntary and charity sectors and social enterprise. Most of my work has been, originally it was in youth work, so I was a youth worker for many years. Done a lot of work in maternity services, early years families, and just general kind of community health. And my background, and this is why I suppose peer research and community research is my area of kind of interest and expertise, is because my background is academically in anthropology and a lot of participatory research kind of comes out of that kind of anthropological approaches. And I also, yeah, anything artistic and creative, I really love to engage with and bring into this. So I work 1 day a week with Newham, and I'm the peer research program manager. So, so developing a peer research program in Newham Public Health. The other days of the week, I work freelance, and I'm also a PhD student. So I'm at Warwick Medical School looking at how we implement co-production within health research. And really importantly, my values, and I think it's really important to share your values, because when we're doing this sort of work, self-reflection and thinking about your personal values really is core to it. So for me, it's about trying to work as in an equitable way as possible, to be as creative as possible. I really enjoy and like try and push any kind of innovative working, and really importantly, to be really reflective where possible. So nothing is ever perfect. Most community engagement, co-production, participatory research is a little bit messy, and that's okay. So it's not about doing things perfectly, but it is about reflecting on what we learn and who we are. And all of my work tries to involve some level of co-production and the kind of ethos of co-production. So we'll talk a little bit about that as well today. And I want to learn. That's the key thing. I want to share what I'm learning, but I also want to learn. So even within this presentation and the end today, I'll be really looking forward to hearing from everybody about your thoughts and experiences. And I think it's really important, I suppose I got this from my youth work days, about starting where people are at. So in the community, that might be starting with people's interests, or it might be geographically, physically starting with the places that they are. So not expecting everybody to come with information or even interest, and not expecting everyone to come to where we are, whether it be on Teams or, I don't know, the Dockside building, but about really starting where people are. So those are my values. So our aims for today. We are going to try and have a little bit of a think within a short period of time, within an hour. Going to learn a little bit about what community or peer research is. We're going to share a little bit about how we're using peer research and community research to explore experiences of type 2 diabetes in Newham. And we're going to try and have a little bit of time towards the end for breakout rooms so you can think about how you might use these approaches within your own teams. So the agenda, we've only got 1 till 2, so it's a pretty quick session for so much. But within that, we're going to do a very quick bit of housekeeping. I'm going to introduce you and show you who the community research team are. We'll talk about what is community peer research and why we do it. Yes, as I said, we'll find out a little bit about the research projects we're working on. If we have time, we can show you about the examples of how we work this process. I'll let you hear from our community researchers. They can tell you about their experiences, and you can think about how you want to use these sorts of approaches in your teams. I'll also send out some slides at PDF, so Noel can share them with everybody. And the last slide will have some kind of further links and resources in case you want to learn more. So language-wise, housekeeping. So language-wise, I'm going to try and keep everything as simple, as inclusive as possible. I really want everyone to feel pretty safe and included really within the presentation, but also the discussion. So just for you guys as well, when we have breakout rooms, just try and make sure that we listen to everybody's different opinions, and yeah, and accept the fact that we won't always agree. If you can have your computer, the video, yeah, so we can see you basically. It doesn't matter so much now during the presentation, but in the breakouts, it's really important. I'm going to try and keep to time, but we don't have much time, so there will be no toilet or tea breaks, but please feel free to just run off if you need to, come back. As Noel said, we're going to be recording this, so please turn off your cameras if you don't want to be filmed. I'm going to ask people to work together a little bit in the breakout rooms, so please do engage and share any ideas and thoughts, and as we go through, please feel free to ask any questions after the presentation, and ask questions of our community researchers as well. So this is our team. There's Fidosa, Jiten, Syra and Ruby. So these are the beginning of our community researchers team. So this is us at the moment. There's four team members. In the future, we would love to be able to think about how we grow the project and the researchers team. But you will be hearing today a little bit from Syra and Ruby, and hopefully Jiten as well, if he's happy to answer some questions. So what is community and peer research? So if you look at the Institute of Community Studies, they refer to peer or community researchers as people or groups who use their lived experience and their understanding of their area, so a social or a geographical community, to help generate information about their peers for research purposes. For me, the kind of key points of community and peer research you can kind of see here below is essentially it's community based. So community might mean local, like the area you live in, but it can also be community of experience. So it might be a health experience that you have, or an identity, or anything like that. Community and peer research is, as far as possible, is led by the community and those peer members. So it might be supported by professionals, so such as myself. I'll try and support our team, but as far as possible, I try and work with them to be able to lead and support them to really take the decisions as much as possible. The important thing is we value people. We're valuing people as experts within their own lives, and we are actively engaging communities so that they can identify, they can explore and analyse and find solutions to the issues that affect them. What's really important and really effective about community research is we can often access some of the less heard voices. We can use it as a way to also activate and enable communities and their involvement. Communities that might already be really active and want to be involved, but maybe not always heard, especially by local authorities, public health, NHS. But we can access those voices, we can enable them to be heard. And it's a really good way of being able to overcome barriers that people might have to accessing or being involved in other types of research or in service improvement. So formal literacy is a really good example. People might shy away from answering questionnaires or even taking part in focus groups, whereas community and peer research sometimes can work through that. Sometimes that might be because we use more informal tools or kind of visual and creative tools, but also I think it's very much because people often feel that they can communicate more honestly and openly with people that they trust or that they have a shared experience or identity with. And really, I suppose a lot of this, it isn't always qualitative. It can be quantitative, so about numbers and details in that way. But often community and peer research is qualitative. So it's really exploratory and understanding people's experiences and their feelings and their opinions. And what I think is really important is that peer research, the approach of peer research and the ethos of it is not, and this is really important, is not just an information mining objective. We are not just trying to take people from the community and get them to do a job for us. It's not about them finding out information and bringing it back and that just being the role. It's also really importantly and a way to meaningfully engage people that might not have otherwise had an opportunity to be involved in this way, to hear from communities we don't hear from, to involve people and to build up their own access to communities and also to local authorities, NHS, and to really build and be more collaborative. So within that, I suppose, really important kind of gears that make that work is about building relationships of trust, supporting people to build skills. So not just the skills that we want them to have to do the job we need them to do, but their skills more widely, and to support them to be involved how they want to be involved, and to support people and realise that people have their own lives. And often community and peer researchers might not have previous experiences or educational experiences, or they might also, as we all are, be managing our own lives. And sometimes those might be tricky in lots of ways. So providing support to enable people to be able to be involved, really. And co-production. Oops, well, that's not supposed to go. Anyway, I'll explain the co-production bit without that slide there. So the idea of co-production is really around trying to understand ways that we can work collaboratively. And co-production is very different, I suppose, than just general public engagement, because we involve people by involving them in the whole journey of a research project and of sharing power with people within that. So participatory and community-based research often has a kind of co-production ethos behind it. So to kind of be more practical about what we're doing in Newham, and to give you an example, I want to talk to you a little bit about the diabetes community research project that we're doing in Newham. So just a very quick overview. You don't need to have all this information, but just for those of you that are particularly interested. So Newham has the highest type 2 diabetes rate in London. We know that over 11% of our population has or is at risk of getting type 2 diabetes. And these bits of information, this knowledge from public health has helped to drive this community research project that we're doing. So in October 2020, there was a deep dive which found that there was an underrepresentation of referrals and initial assessments from people from Black, Asian and minority ethnic backgrounds, and that often there was a much lower uptake of programs, so of weight management and or diabetes prevention programs for people that were living in the most deprived areas of Newham, and that the diabetes rates and the kind of tests, so we know what level of the hemoglobin levels in people. We know that the Black, Somali and Pakistani men were found to be disproportionately off target for that. So we know that when we look at ethnicity, for example, in diabetes, that there are certain populations in Newham that are much more at risk, but are much less likely to be taking up the kind of prevention programs and support. And there's loads of reasons behind that, but we need to know why those things are. So one of the reasons that this project was started was because Newham Public Health are really interested in understanding the why behind these numbers. So this is kind of the reason we started the community research project. So there's loads going on in Newham around diabetes prevention. There's other research projects as well, and we'll link up with those where we can. But the reason for this was because we wanted to begin by developing and supporting a team of peer or community researchers who obviously they can't represent the entire Newham's communities, but we wanted to represent some of those diverse communities, and as we grow, to make sure we're including ones that are not represented, and enable and support them to obtain and share insights that can help inform service development, and essentially to be able in the long term to help support people who have got diabetes or who are at risk of diabetes to have better health outcomes. So the reason that we're doing it and the way that we're doing it is because by having a community research team, that enables us to engage with people in a different way. So we can engage with community, key stakeholders, other community members, and we involve people and engage, so the community research team, in co-designing what our research questions are. So it's not that we necessarily say, you need to find out just this. We'll work with them and say, this is what Newham is really interested in, or this is what we've heard in some of our data. What should we look at? What do you think is important? And we design those research questions together. The participant recruitment, which is deciding who you're going to involve or trying to reach out to who takes part in research, that can be done again collaboratively. So it might be Newham Public Health saying, right, let's ask these people. It might be one of our community researchers saying, oh, I know a group here that we could go and speak to. So it's about doing that together. And it's about co-facilitation of research. So not just sending people off to do stuff, especially if they don't have those previous skills and experiences, but co-facilitating, so that we're supporting people to do interviews, to take part in focus groups and facilitate focus groups, and to be able to reflect on the data that we're starting to hear, to analyse that, and as we're doing at the moment, to do that analysis, highlight what our key findings are and support our community researchers to make recommendations, and to be involved in the action that is then taken. So essentially the main aim is about understanding people's lived experiences, gaining insight for the diabetes prevention work into the motivations and challenges or barriers around people's behaviour change, and really thinking about how and why people either do or don't access and take up services. So as I said, I'll send out these slides so you can kind of see them in more detail, but just to let you know what we've been doing. So when we first started this project, we did some recruitment. We recruited 4 women, 1 man, all who have got lived experience of type 2 diabetes. So lived experience meaning either they have diabetes or that they have family members or friends or some sort of contact with community in some way that they have experienced what diabetes might mean for people. We wanted to make sure we had a mixture of people from different communities. So we have people from Somali, Pakistani, Indian communities. We have some great language skills within the group, even though it's only a very small group. They speak Somali, Urdu, Gujarati, Punjabi and Hindi. And we recruited people obviously from the Newham community. We did that via word of mouth, the COVID champions groups and different community meetings. Next, we'll probably look at recruiting more people and build the project. We started very much within the community, so we facilitated some sessions with just generally people interested in diabetes and weight management in Newham, and they helped us to inform the kind of general approach and the line of inquiry. That's something we'd want to continue doing, so we'll probably in the future will set up some co-production workshops so that we can think about how we share the data that we're hearing about and involve people in that cycle. There's been lots of training, but what we haven't done is make it really formal, because we want people to be able to access it and not worry if they've missed a session, for example. So the training with the community researchers, a lot of it has been online, so meetings with me, some of it in practice, going out and doing stuff, but it has covered things such as confidentiality, research ethics, research planning, research methods, and thinking about reflective practice. They've also been able to access other relevant Newham training, which has been really, really helpful. And we've been working on providing training sessions. So I did a session with the Newham outreach team, thinking about community insight gathering, and obviously the session today. And these are all things we want to continue building more, looking at accreditation opportunities, that sort of thing. And it's really important that people develop their own research. So the team have worked together to kind of start with the initial creating what our research aims were. They decided on methods, and they planned the sessions. They started by telling their own stories through kind of semi-structured interviews, which is a really important process. They practice skills with their friends and family, and they've been out obviously doing research sessions. So we've been out with the health bus in Newham to the library, weight management programme. We went and did interviews, and they've also been working collaboratively with other groups. So this is really important about building people's skills and networks. So they've been involved in a research project with the Oxford University Food Champions. So they've been not only been involved in the focus groups, but they've actually helped co-design how those focus groups are. So they fed into that, which has been brilliant. And they have been insanely busy attending community events, conferences and workshops, and attending public health meetings. So very, 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 very busy. And just to give you a bit of an overview and also a link to where you can find out more, the kind of process that we follow within this is very loosely, actually looks very much like this community insight gathering process, which you can see on the Lottie website, which I'm going to share with you, which was a coalition of London boroughs, which included Newham, that looked at how we gather community insights. But there are some great tools and links on there, so I definitely recommend looking at it. But essentially, you think about this kind of before something happens, during and after. And the before is about, working with people collaboratively, co-producing. So what is it we want to do? What's the project? What's the idea? What is the question? How do we prioritize that? So working with the team, that's what we've done. And then the project is what we've been doing at the moment with the diabetes, is exploring the idea, defining what it is we want to know, starting to source the data, so asking questions, doing focus groups and interviews. And then at the moment, we're at the point where we're starting to interpret that data. What does it mean? What's important? And then being able to create insights and information that can be used. And then the next steps with that, what we're doing, I suppose today is one of the first things of us sharing, is starting to sharing what we hear. So it's not always a final. This isn't doesn't just end there. But this idea is that we continue these ways of working, and it becomes an iterative process. So lastly, the last thing I want to show you very quickly is just an example of how we work in practice. So with the team. So as I said, it's really important, I think particularly important in peer and community research, that we support people and we're really clear with what we're asking people to do. So we don't just say, right, can you go and ask these questions? Off you go, come back and tell us. But even our sessions are really detailed in our plan, and we'll go through a plan when we meet up before we do a session, and we debrief, and those things are really, really important. So this is an example from one of our recent sessions. We went to Forest Gate Library. So we have the session details, we'll have the dates and where it is that we're meeting on a sheet of paper, so obviously people can get there. And we have a plan, so we know our times, and then we think about what our aims are. So for example, in this session, we were aiming to really build skills and to develop that the experience of introducing ourselves as community researchers. We decide what methods we were going to use. So for this session, we did participant observation. So that's kind of watching and observing how people were behaving and what was going on in the session we attended. And we did mini unstructured interviews. So this is what the peer researchers went out. We had a little mini script on here, so they know what to say, helped people to think about how they're going to introduce themselves, and a kind of suggested open questions people could ask. And then on the back of the sheet, you'll see there, we have the debrief. So after every session, and this is really important, we debrief. So we'll all sit down together and we'll audio record us talking about the key points that we heard. And this is really important because what we don't want to do is make everything written. So it's not just about your literacy levels, but it's also about how you communicate what you've heard. So if we audio record, it means that people are probably going to share much more about what they've heard in that research session. They can talk about what someone might have told them in an interview in a much more detailed way than writing it down. So we do that in our debrief, and then we also think about how the session went. So it's again that aspect of support. And we have information, obviously we always go over around confidentiality. So even though peer and community research might be or might seem more informal in some ways, it's really important that our processes are still very safe and that we have good structure around that. So for example, confidentiality and informed consent. So that was a huge amount of information that I've given you guys in a fairly short period of time, and you're probably already sick of hearing me speak. So I'm going to now pass over to some of our community researchers, so you can hear a little bit more from them, and then you'll have a chance to ask some questions. So first of all, I'm going to introduce you to Syra, who couldn't be here today, but she has pre-recorded a message for you all. And then that's just a few minutes, 2 minutes long. And then I'll introduce you to Ruby, who will talk to you a little bit about her experiences of being involved in the team, and also a little bit of what they're hearing on their diabetes research. So here is Syra.
Hello, my name is Syra Malik, and I'm a local resident, and I'm proud to be a member of a community research project on diabetes. I first learned about the project through an exercise class that I attended and was keen to join as I wanted to know what this entailed, and so in turn how I could help my family members and the wider community. I'd like to say this has been a very amazing experience and has enabled me to meet many people and attend events, focus groups, research groups, conduct interviews and receive invaluable training. Within these spaces, many matters have been raised, but for me in particular, I've found issues of accessibility to services and lack of provision with regard to healthy eating and exercise. In Newham, there are lots of programs that are currently taking place. However, if people do not have access to these platforms, they'll not be able to engage. Likewise, specialist programs such as exercise on prescription and diet plans only seem to be available if people are diagnosed as being pre-diabetic or diabetic. Finally, another reoccurring theme was a lack of provision of healthy food options in the high street. Time and time again, people have stated these places were frequented due to accessibility and being cheaper options. These are just a few things that I've learnt, and it's hoped that the team will be able to share this with other groups and so help facilitate a better service and system for people in the community. Thank you. Hello, my name is Syra.
Try and hang on. There we go. Okay, so that's hearing from Syra. We also are very lucky and very happy that Ruby and Jiten could join us as well. So I'll ask Ruby now if you're happy to just take a few minutes to share whatever you think is important to share, what you think people should learn about your experiences of community peer research, and the experience of either taking part as a peer researcher and or in what you've heard. So yeah, over to you, Ruby.
Thank you, Emily, and thank you so much for having me here today. I'm very proud and I'm very honoured to have been selected as part of one of the community peer researchers for Newham Public Health. and working for such an amazing team with Emily. I've been working with Emily for over a year now. It's coming up to almost 18 months. And I have to say, it's such a pleasure working with Emily and the team. It's so structured, it's organised, and it's supportive. And I have to say, honestly, it's been a fascinating and educational and humbling journey, which has really enabled us as peer researchers to help the community really overcome obstacles and barriers. And just to say, I have a little bit of background about myself. I have over 20 years experience in the health, nutrition and fitness industry. I currently work as a nutritional therapist for Active Stars in Redbridge. I'm also a qualified yoga and dance instructor. And what we do with Redbridge particularly is support families and children who have diabetes and obesity problems. And it's basically educating them. And like Emily said, I want to learn. And I want to learn where people are at and meeting them where they're at. So, you know, within our group and within our scope, there's no judgment, no criticism. It's just hearing, listening and observing without judgment. I came into this role as a community peer researcher for diabetes, actually by chance. I live and work in Newham, in the borough of Newham, and I had actually enrolled my mother onto a diabetes program. She's pre-diabetic, and you know, I was supporting her because this program was offered during lockdown, and she actually struggled quite a lot with the technicalities of joining. Being 80 plus is kind of not surprising, really, you know, I really wanted to understand more about diabetes on a local level. And so I applied for this position and, you know, feeling very passionate about, you know, what I do, not just to support my mother, but also other clients. Once I actually got selected for this position, I was so thrilled. I've never looked back. And I'd like to say that I feel very proud and grateful to be part of a team that's so passionate about understanding people's lived experiences, that it's actually enabled me to understand the challenges that people face, not just from the community level, but also from the council. So it's actually like piecing the puzzles of a jigsaw together. And so along the way and over the past year, I feel that our team as community researchers, we've actually grown organically and holistically, really involving and enabling the community through a really positive journey. And I think what's, you know, it's enabled me to attend training on diabetes through Xyla Health with Emily and the team. I've trained in conducting focus groups. I've learned about interviewing and learning about the challenges that people face having diabetes, and also being a member of the researchers panel for Oxford University with Prachi and Jess's team, and being a participant observation. All of this has really helped me to have such a thorough understanding, and really the understanding of the depth and breadth of the challenges that are faced by local communities and the local residents. And I'd just like to take this opportunity actually to share with you what I gained, particularly from the Oxford University research team that I was on. So over the summer, there were many opportunities for me to join the team, and we looked at what factors affected unhealthy eating and the challenges and the obstacles that everyone faced. And what was actually revealed was multifaceted. So there's a real, what's actually hidden in between that is that there's actually a real desire and a hunger for change, and a hunger to change in mindset, and a real desire actually to be educated, and shifting the focus towards eating a more healthy, nutritious, wholesome and unadulterated, unprocessed foods within Newham. But unfortunately, it's just not as readily available or accessible or even affordable as the more unhealthier and cheaper options. And lastly, attending recently with Emily, the Stratford Healthy Weight Management, Diabetes and Obesity Programme. That experience really enabled me to understand more about the seriousness of the issue that we're facing. And it was really fascinating and educational, which enabled us all really to actually connect the dots with other like-minded professionals and really feeling that passion that came out through wanting to make a difference to the community. And I think that workshop was so invaluable, which allowed us all really the freedom to be able to connect the dots and brainstorm within the community towards actually veering towards leading a more healthier, fulfilling lifestyle. And I'd just like to end really by just summarising, just to say that becoming a community researcher for diabetes, working with Emily's team, was a very proud moment for me, because I feel that I'm actually giving back to the community, something that I actually really love to do. And I feel very, very passionate, just like all the other members on our team are. So thank you very much.
Well done. Thank you so much, Ruby, for sharing. It's great. It's so nice hearing, even though the bits and pieces that we've been involved in the whole way throughout, but it's always so nice hearing how you've experienced it. I think that yeah, means a lot. So thank you. Jiten, I'm aware that I don't want to put you on the spot because you weren't sure whether you were going to speak, but if you'd like to, do you want to share a little bit about your experience or thoughts? Or
Sure, few words, yeah?
Yeah.
Because you, Emily and Ruby have said it all. I have no words to say. That's all I can say. I'm really privileged and honored to be in a team and learn about diabetes, because I'm diabetes 2 myself, so type 2 myself. So it's I mean, further up and stage up to know and what is going on in community about the diabetes type 2 and the healthy eating, that how it prevents, and especially I saw it at the library at Forest Gate about how they teach how and explain how to prevent the diabetes type 2, like by eating healthily and exercise. And very educational. And Emily is a very great teacher, actually, in a way that she trained us very well, and she's got very good. What can I say, Emily? That you have patience a lot, actually. So thank you very much, and I'm really honored to be in the team, and I got this. Involved through a COVID champion, so it was amazing anyway. So we'll keep the work up, so thank you. That's all I can say. My name is G10. I live locally here in Newham. That's it. Thank you.
Thank you so much, Jiten, and especially for doing it on off the cuff. So thank you so much. So Ruby, Jiten, and Sarah, thank you all. Sarah's obviously not here today, but thanks very much for for sharing. And as you can see on a few of the comments, people also saying about the amount of passion that they can hear from you guys. And I think that's part of it. It's about all of us being able to be, to share our desire to want to make change in the community, and that passion always comes through thinking community and peer research. I've seen that there's a couple of questions in the chat, but I'd also like to open up in case anyone has any other questions, but I can answer a few of them very quickly that I can see. And then if people have questions for Ruby, Jiten, for myself, and then we'll make sure we have a few minutes left for discussion as well, for if we want to put plans forward. I saw someone ask about the reward and recognition policy. That's just essential. Like, you have to pay people. You're going to get people to do stuff. You have to pay them, and you don't pay them in vouchers. That's so annoying. It's really important. So we pay our community researchers based on the Newham co-production something or other reward and recognition policy, blah, 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 which I think is £10.85 an hour. So yeah, and everywhere pays different amounts. So I think, I mean, that's the basis that we use in Newham. But I think if you work, if you're doing work within the NHS, there is a patient and public involvement policy that I think is slightly different. But yeah, it's super important to pay people, and you should be paying people not only monetarily, but also I think about trying to enable skills development, and if there are training things available, or if people want to have new experiences. I think it's all of those things, maybe talking to people about what they want to get out of why they're doing it. So it's not just money, because people don't just do it for money, they do it because they want to learn or because they want to make a change. And so I think it has to have that balance. Theo, really nice to see you. That's so cool. I've shared a little message in there. So I used to learning sets with you. So really lovely to see you. Yeah, your question about the debrief. So you said, yeah, that audio debrief, do we then write it up or share the recording? So a bit of both. It's a really good way of being able to do it, because when if you ask people to do a written debrief, or like written what they've heard afterwards, you lose so much. And it also then relies on literacy, which even if you are literate, it makes it, you just don't communicate in the same way. So we audio record them, and then where possible, we then I'll either put them into a program which will transcribe that audio recording, although we haven't done that on all of these yet, or just listen through them and make notes about what some of the key points were. So it really depends on your level of resource. So at the moment in Newham, we were hoping to have someone that would just be doing the data analysis, because I only do 1 day a week. So we're pretty limited on what we can do at the moment, but there's different options for how you can do that. And what's some of the other questions? Oh, someone said, do participants have a chance to get publications from the research? That would be super cool. We haven't published the work that we're doing at the moment. It's actually a bit harder to publish in different ways. So we'll probably share our work in some ways, publishing it. But academically, it's quite difficult, because to do academic publications and co-production and public engagement, it's actually really tricky to involve people the whole way throughout. And we haven't done it in that way. So we will be sharing, and people will have their names on any work that they've done. And we'll also look for opportunities for how we can kind of develop that further. But the work that we're doing with so these guys have all been involved in the Oxford University research programme, which is very academic, and will be published, and they will all have their names in shining black print on the publications there. So absolutely. Someone else asked, I think, about the analysis. So we're just doing the very, very basic thematic analysis, really, and we're coding that to the art framework in Newham. So we're looking at coding it by art, which is, I'm going to get this wrong now, accessibility, relevance, and trust. So, and then other. So where we're hearing stories and or points, we're looking at trying to organise that by what things around accessibility, what things are around relevance for people, especially cultural relevance, and what things around trust. And that's because that's the framework that Newham are using. Yeah, I think that was it. So I don't know if there's any other questions. Please just unmute yourself and ask. So myself, Ruby, or Jiten, and then we've got 15 minutes left. So if we do maybe 5 minutes of questions and then 10 minutes of breakout, or if there's just questions, whatever works best. But yeah, feel free just to unmute yourself and ask.
Hi, I have a question. My name's Imogen. I work for Islington Council. Thanks so much for that. That was honestly really, really inspiring and really, really interesting as well. I have a couple questions. So one is, I wondered if you could just explain a little bit more about what you mean by being part of the Oxford Uni research programme. Do you mean did Oxford run some kind of training that they're involved in? Could you just explain a little bit more about kind of how you got involved in that partnership? And the second thing is, you mentioned at the beginning that peer research is mostly used in the context of qual. I wondered if you could talk through a little bit about how you could see peer research using for quant research. Thank you so much. Okay.
I don't know, Ruby, do you want to explain a little bit, just a real quick intro of the work we're doing at Oxford University? And I can fill in any gaps that you're not able to, but do you want to go ahead?
Yeah, sure. So the work that we've been doing with Oxford University, so they're a group of researchers that are employed by Newham, and they are looking specifically into what's leading what's the cause behind Newham's sort of obesity and diabetes epidemic. And so it's very, very narrow. It's a very kind of a focused group that they're actually interviewing pockets of Newham. So actually, I think there's I think they're called wards of the various boroughs within Newham, and they've gathered select participants that are all from the community, all that live and work within Newham, and they segregated it by different wards within Newham. And our role, where we fit in, is to, because of the training that we've had, we're actually in quite a good position to actually be on that panel of researchers, but actually observe and watch and listen. And there is actually quite a profound skill in doing that, because you kind of feel, as one of the researchers, you actually feel that you want to also interject. You feel that you want to say things like, yes, I understand, I really get that, and oh, that happened to me, or that happened to my client or my sister or my mother. But one of the kind of key factors in our role is that we actually have to push back and stay silent, kind of silently observing. And that's the kind of the training behind it, because you want to feedback, but we take it all in, we kind of absorb, we digest, we really take it in, and then we feed back to our team, and then we debrief, like Emily was saying earlier, that the debrief is so important. And each time we had those focus groups, we had Prachi and Jess and I and the relevant community researchers, we debriefed and we talked about the session, and we we really kind of dissected every single aspect, and it was very in depth and very, very thorough, I have to say. And it was so insightful, like I said before, and because we feel so passionate about it, we really want to really home in on really splitting the hairs and really understanding really what the panel on there, and also the community within the community residents, what they're actually saying, what message that's coming across. And it was very structured, and each group were given the same questions, the same slides, the same presentations, but obviously a different cohort of people, but all from Newham. And I find that that's what's really fascinating. I hope, if I've left any gaps, Emily, please fill them in for me.
No, and more than I probably would have thought to say, like, of the detail of it, like, it's really important. And also because so with that project, whilst this is our team and I supported them to become involved in that, I've stepped back and back away. So I don't actually know about all the details, some of what they've been doing with that project, because it isn't just about, and I think this is it around peer and community research, it isn't about us then just holding it, it's about allowing people to kind of create opportunities. So supporting that initial involvement, and I'm still obviously involved with the Oxford University researchers and enabling the relationship with the community researchers. But also, I haven't attended all those focus groups with you guys. You guys have been off doing amazing work with them. So much I don't know about it. Within that, I think the kind of question was about also opportunities for how to be involved in things like that. Maybe I think that was one of the part of the question. So that's a research project that was happening within Newham, so that we could link up with and be involved in it. I don't know about Oxford University, but just as an aside, the University of Cambridge have got a patient-led research hub, which might be of interest to people. If you just Google it, I don't know what they're doing with it now, but I know a couple of years ago they had a lot of funding and support and work to be able to enable community organisations to be involved and leading their own research. So it might be something people want to have a look at. Yeah, any more questions? Please just unmute and ask.
Hi, I have a question. My name's Hannah. I work in Camden Islington Public Health team. I just have two questions. Do you hire peer researchers for specific projects, or will your peer researchers have an opportunity to work on other projects that might come up? So I understand that you're working specifically on a diabetes project right now, But in the future, if you were to set up another project, would you have to rethink about what constitutes a peer, and might you have to sort of change your recruitment? And then also, is there a minimum amount of time that peer researchers need to commit to a particular project? Thank you.
So, and I'm just write it down. So first of all, do we hire them for a specific project? We did for this one, for because we're looking specifically at the diabetes prevention. But as we've already started talking to the peer researchers about, it's also about looking at wider things. So nobody has one personal experience only. Everybody has so many. So it might be experience of childcare and maternity. It might be experience of any other health issues. And what we'd be really keen and we want to do is make sure that our peer researchers have got opportunities for involvement in other things. I've already been getting requests, or I've been able to respond to them from our public health team to say, oh, can they help us on this, or can they be involved in that? And that's the things we really want to be able to do. But at the moment, it's really about capacity, and because I'm only 1 day a week. But the idea being that we would love to be able to build a team of community peer researchers that can be involved in any projects that come up that may have interest or lived experience of. What a next part of our project, I would think probably would be, is to choose another theme or area of interest that these guys could be involved in if they wanted to, but also to bring in and recruit some new peer researchers that might have a specific experience that they're interested in, but always being aware that people have wider experience. And I think, yeah, that's really, really important. So yeah, absolutely. I mean, they're going to not have opportunities. They're probably going to be inundated with requests to be involved in other projects. It'd be the opposite. We're trying to manage the public health team wanting to be involved with them. But yeah, so absolutely. Is there a minimum time to commit? Absolutely not. And that's the reason that one of our peer researchers isn't with us today. Actually, two of them, but one of them is taking a bit of a break because she's moving house. And it's really, really important that there's that flexibility. So when someone's got, I don't know, it might be literally anything. It might be just life stuff that's come in the way. It might be health things that have an impact. It doesn't matter. It's about creating a really supportive and inclusive environment. And that's why as we develop, and I was talking to them about it, how we develop this peer research program, when we bring in people, we need to think about how formal do we want to make our training. So the training so far has been very informal. We have had sessions which are specifically on different areas, and we've looked at those. But what I don't want to do is create a program where if someone misses a day, they miss that bit of the training, or that someone feels bad because they can't attend, or just because they don't feel up to it that day. You know, it's about creating that flexibility, and so that really is around the time commitment as well. I think when we did the recruitment, we probably asked like a rough commitment of 12 days or something a year or something. I can't remember what we asked, but it's not something strict. It's more to give people an idea of what we might want to ask of them, rather than them having to do that. I'm aware we've only got 5 minutes left. No, I don't know how you feel, but if we're good just to do questions rather than breakout, or
yeah, that sounds good.
If anyone else has got any other questions, please, yeah, just unmute and ask.
It's that time of day, isn't it? People. Oh, we've got a question from Marta.
Hi, sorry, mute button. Thank you so much. This was really, really interesting. What amazing work you're doing. I'm from Westminster City Council, and so I know, of course, this was, based on the diabetes topic, but I was wondering if you find that there are certain topics that lend themselves either really, really well for this kind of research or really, really not well. Yeah, thank you.
Absolutely. So one project that is one of my favourite projects that I've done with peer research was around maternity. So but that was quite a few years ago, and I trained a team of 15 people with lived experience of maternity services from really diverse backgrounds in North Central London, and they were involved in informing the Better Births kind of maternity transformation, and it was really I think it was a really effective project because people, obviously it's something they really, really cared about, something people have very different experiences of. But I think so maternity often lends itself to it because people might have, they'll want to be involved and continue to improve services. So I think often peer-led and community research is often works really well with areas of health where people might be returning. So, for example, long-term conditions or maternity or things that they're going to kind of return to. What it might be trickier with is things that maybe is like a quick one-off. So, I don't know, A&E attendance. You might have people that want to be involved in that, but the quick things that maybe someone only does on a once. I think it's about thinking about how is it relevant to people and communities. But I think people are just interested and want to be involved and improve services and improve other people's experiences and their own very generally. But yeah, I think often long-term conditions and or health that people continue to experience, that lends itself, I think, often very, very well to it. Hope that answers. Yeah, and anybody else, any questions, please just yeah, unmute.
Jonathan, do you want to jump in and we'll have that as a last question?
Yeah, just so I work in Newham as well. We looked at the data around diabetes. So when people get diagnosed with diabetes, they had extremely high blood sugar levels. And we kind of spoke to some clinicians saying, you know, these are off the scale, what's going on? And they said, yeah, sure, there's like massive stigma. People would refuse to acknowledge it, you know, even if they're injecting insulin, they don't even tell their partners. And so, you know, real sort of stigma issue affecting diabetes care, diagnosis of it. That was very interesting. I didn't know it's so stigmatized. But yeah, I was just wondering if that had been like borne out in what you had done and what had come of that, I suppose. I'm
going to pass that over, and then I can answer as well any little bits and pieces. But Ruby Jiten, do you want to answer to that? Is there anything that you've particularly heard or from the community or experienced? They're thinking around stigma or anything in that relation to diabetes.
I think yeah, you're right. Actually, that was quite an alarming observation that we also observed. But I think it's not as openly spoken about, and I think the kind of the crux of it is education, really, because people aren't really educated as to the seriousness of it. It's almost become kind of the norm, and that was one of the things that really that came out from all these focus groups, especially the ones that we did with Prachi and Jess from the Oxford University. People noted that now, you know, becoming oversized or obese or having diabetes, it's becoming the norm. And maybe, you know, a few decades ago, when I was growing up, it just, you know, it just wasn't the case. And I think also sort of naming certain things like, you know, obesity or fat or etc. You know, people are very sensitive to how you word things, and I think that was one of the training sessions that we had with Emily and Jiten and the group through Xyla, and that was really just very, very educational, not just, you know, for the participants, but for us as community researchers. And I think it's just really acknowledging where we